Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. Focus Ultrasound is revolutionizing healthcare as a non-invasive, cutting-edge therapy offering hope for countless patients. In this episode, we speak with our experts at the Foundation who highlight the most remarkable achievements from 2024 and discuss what's on the horizon for 2025. We cover the latest news in Alzheimer's research, advancements in treatment for chronic pain, the emerging field of non-invasive veterinary medicine, and current research using Focus Ultrasound in cell and gene therapy. To start off our recap, here's Dr. Neil Cassell, founder and chairman of the Focus Ultrasound Foundation.
2024 was another great year for the field of focused ultrasound, where the momentum continues to grow and the field continues to advance in terms of new indications, new mechanisms of action, new manufacturers, the number of patients treated, the number of regulatory approvals, the number of insurance companies, both commercial and government, that are covering these treatments. The media attention, both print and broadcast and digital. So we are truly at the inflection point of this exponential adoption curve, where the dialogue has absolutely shifted from if focused ultrasound is going to have a major role in the therapeutic armamentarium to when, from if to when. But also in 2024, it became absolutely clear that we're now transitioning from what was historically mostly a research and development environment to the beginning of a commercial patient treatment environment. And the number of patients treated in 2022, it was about 100,000 were treated around the world for a variety of medical conditions in about 1,000 commercial treatment sites. In 2023, it was 150,000, and we're on our way in the next 5 to 10 years to treating about 1 million patients per year in as many as 10,000 commercial treatment sites. So we're at an extremely exciting point in the evolution of this technology, because we're right at the tipping point where it's becoming very real, and the number of patients that can be treated is increasing. The number of patients who are currently having their lives improved is fairly dramatic, but the other thing that we've now been able to do is to give hope for hundreds of thousands of additional people. And the most common term that people use for their experience with this treatment is, it's been a miracle. It's given them back their lives.
Are there any indications that we could see a lot of rapid movement or a lot of development with in 2025?
Yeah, I think that the prostate cancer will continue to advance very rapidly. It looks like we're going to get some good results, at least I'm optimistic, on benign prostatic hyperplasia, which is a huge problem, a huge market. I think that the early stage work that's coming out on Alzheimer's is very encouraging. We've had very, very good results treating some of the symptoms of Parkinson's disease, but now as a result of with preclinical translational research studies and clinical trials, there's a great opportunity emerging for treating the underlying cause of Parkinson's and stopping the progression, if not even reversing the neurological deficits. So that's really encouraging. The other thing is, in the area of cancer and cancer immunotherapy, a lot of real good progress in pancreatic cancer, starting some studies, new studies for sarcoma. Between the neurodegenerative diseases, Alzheimer's, Parkinson's, Huntington's, ALS, dystonia, the psychiatric disorders, OCD, depression, and then cancer immunotherapy, particularly glioblastoma, pancreatic cancer, liver tumors, soft tissue tumors like sarcomas or melanoma. The amount of progress is staggering.
What are some of the biggest barriers right now? I mean, you mentioned we're at a tipping point, but what's still holding the field back?
What's holding the field back primarily is lack of awareness of the clinicians as to the benefits of focused ultrasound, and amongst the patients don't know, lack of awareness. There's not enough clinician champions to treat the patients yet. So those are the primary barriers right now.
And looking ahead, is there anything else you're expecting to see in 2025?
Well, I think that we'll have additional evidence on treating a variety of cancers with enhanced drug delivery, cancer immunotherapy, the whole gene and cell therapy approach. If you look at the number of mechanisms of action of focused ultrasound that can be deployed to treat these variety of diseases, there's a lot of new information that's being developed that will be very helpful. And then the preclinical translational research studies have moved ahead, and now we've got clinical trials that are being launched in a wide variety of disorders, again, with emphasis on neurodegenerative diseases and cancer immunotherapy. I think one of the measures of, or indicators that we're transitioning to the commercial patient treatment environment are the number of new companies, the number of companies that are actually generating revenue and starting to look to be profitable, the number of investors, both serious institutional investors and strategic investors. All this is an indication that the field is really taking off.
We spoke even more about how focused ultrasound can be used in the treatment of neurodegenerative conditions with Dr. Susie LeBlanc, neuroradiologist and director of clinical relationships. We saw some very promising research using focused ultrasound in the treatment of neurodegenerative conditions. Can you tell us what developments were made in 2024?
Sure. Right. There's been so many interesting research projects coming out in 2024. Perhaps with Alzheimer's disease, there was something really exciting that came out of West Virginia University, the Rockefeller Neuroscience Institute, and Dr. Ali Rezai's group. And what they published for the first time was that opening the blood-brain barrier along with the administration of an anti-amyloid antibody named aducanumab, there was a dramatic decrease in the amount of amyloid in the area of the brain that also received focused ultrasound compared to the side that didn't receive focused ultrasound. So what that meant was that in addition to building on our knowledge that opening the blood-brain barrier alone can help activate our own immune system and recruit microglia cells and our own endogenous antibodies to help get rid of the amyloid in that region, that also opening the blood-brain barrier along with the administration of a drug enhanced the removal of amyloid from that area of the brain. And those results were published in the New England Journal of Medicine. And I encourage you all to go and look at the pictures, because you don't need to be a neuroradiologist to see the dramatic reduction in the amyloid on the side of the brain that received the focused ultrasound compared to the side that didn't.
That's incredible. And what can we expect for 2025?
Well, in 2025, there was just a recent publication in the Journal of Neurosurgery by Dr. Jinwoo Chang's group out of South Korea. And this was also quite fascinating. Multiple studies over the past few years have shown that opening the blood-brain barrier alone in patients with Alzheimer's disease is safe and can decrease amyloid. And little by little, the studies over the years have opened larger areas of the brain with the focused ultrasound blood-brain barrier and have done more sessions over a certain amount of time, so increasing the frequency of the focused ultrasound treatments. But in this last study in 2025, Dr. Jinwoo Chang and his group built on his previous publication where they opened 21 cc's volume of the brain and doubled the amount of opening. It was now over 43 cc's of volume of opening of the blood-brain barrier with focused ultrasound, and increased the frequency of the sessions. And what they found was that repeated and more extensive focused ultrasound blood-brain barrier opening on both the right and left frontal lobes was safe and potentially beneficial to patients with Alzheimer's disease. Not only did it decrease the amount of amyloid longitudinally compared to the previous studies, but there was also an improvement in one of the scales that measures clinical outcomes in patients with Alzheimer's disease. It's called the CGA-NPI score. And 5 out of the 6 patients in this study demonstrated a decrease in that CGA-NPI score. And in previous studies, those results were present but less significant. So he built on his previous knowledge by opening larger areas of the brain with more sessions and had a more significant decrease in the amount of amyloid and a more significant decrease in that CGA-NPI score.
In 2025, will we be seeing a larger study conducted to see how this affects more patients?
Yes, and this is really important work because he really created new data on opening the blood-brain barrier in larger volumes of the brain with focused ultrasound alone without the administration of any drugs whatsoever. So we need to really support his research and other research around the world to show that, amyloid can deposit in many areas of the brain, not just the frontal lobes, but also the temporal lobes. And we need to start opening larger areas of the brain and to see if this technique alone, just the focused ultrasound blood-brain barrier alone, can really treat patients with Alzheimer's disease. We're not even sure which stage of disease it could be most beneficial in yet. Is it best in patients that have amyloid that haven't developed symptoms yet? Is it in patients that have some amyloid but minimal symptoms? Or can it be used in patients with more significant Alzheimer's disease and really try to remove that amyloid as well? So we really need additional studies, larger randomized clinical trials, and with patients at different stages of disease.
Focus ultrasound is also being used in treatment for mental health conditions and addiction. So what's the latest for those conditions?
Oh, that's a fascinating topic, and I love talking about it because psychiatric problems around the world right now are a significant public health concern. 1 out of every 5 people will experience some type of mental illness around the world. And I'm very happy to report that focused ultrasound is addressing this issue with a mechanism of action called neuromodulation. And there are 8 different psychiatric conditions being researched now in clinical trials. And those include patients with depression, schizophrenia, anxiety, obsessive compulsive disorder, addiction, autism spectrum disorder, post-traumatic stress disorder, and even those with attention deficit hyperactivity disorder. So we're very excited that there's really promise for patients that are suffering from these diseases and conditions that either don't want to take medications or medication refractory, meaning that 20% to 60% of patients try the medications for these conditions, but they don't respond. And of course, existing surgical options are quite invasive. So focused ultrasound could really play an important role in addressing this major public health crisis.
We also saw the results of clinical trials using focused ultrasound in breast cancer treatment this year. So what is the latest in that area?
Right. So in using focused ultrasound treatments for breast cancer, we've really made remarkable progress. There are actually multiple mechanisms of action by which focused ultrasound can address breast cancer. We know that doing thermal ablation can be helpful in kind of ridding, quote unquote, the primary tumor. And also that thermal ablation can help release certain tumor antigens that can potentially help ignite an immune response. Our own body can help fight the breast cancer. Another way that's been very exciting in 2024 is with what's called radiation sensitization. And focused ultrasound can actually enhance the ability of conventional radiation therapy to work. So a promising study out of Sunnybrook Hospital in Toronto with Dr. Sarnata was published in 2024 and showed that the areas of breast cancer that had focused ultrasound in addition to radiation improved more significantly than the areas that just received radiation alone. So that's really promising because that can help patients dramatically. Number one, it can decrease the amount of radiation necessary to an area, giving focused ultrasound along with the radiation, and which will decrease side effects. And number two, you could probably increase efficacy. Like I talked about, the results published showed that the areas that received a focused ultrasound did better than those without. So we can decrease side effects and increase efficacy. In addition, just to close out the effects of focused ultrasound with breast cancer, so we have the ablation, we have the radiation sensitization, and you can also help increase the delivery of immunotherapies to areas of breast cancer and enhance the effect of immunotherapies. And this is really a hot topic, giving immunotherapies to help treat cancers. So there are clinical trials with that as well.
Next, we spoke with Dr. Lauren Polovich, Associate Director of the Research and Education Team, who also shared about how focused ultrasound is being used to target specific regions of the brain. Chronic pain is one of the areas you've been keeping an eye on, so can you tell us about how focused ultrasound is being used in this type of research?
Yeah, so chronic pain is an umbrella term that's used to describe a lot of different painful syndromes. So it could be fibromyalgia, it could be chronic back pain, or it can be something a little bit more targeted like trigeminal neuralgia or what's called chronic facial pain, and certain pain syndromes after surgical procedures and cancer pain. And so there are actually 3 different mechanisms that are currently being studied for the treatment of chronic pain. The most new and exciting one is what's called neuromodulation. With neuromodulation, low-intensity focused ultrasound is used to target specific pain pathways in the brain. And there are currently 2 clinical trials ongoing, one at Virginia Tech, which is enrolling patients to look at neuromodulation of different pain circuits within the brain, and then another clinical trial with a device that is an early stage device called the Spire Diadem device, which is also looking at neuromodulation in the brain.
We're also seeing focused ultrasound be used to target the thalamus. So can you tell us more about why this is being used in clinical trials for chronic pain?
Yeah, so the thalamic ablation, which is MRI-guided focused ultrasound, so a different mechanism which uses high-intensity focused ultrasound, is being used to thermally ablate various regions of the thalamus. And this type of procedure was born out of the early treatments with thermal ablation to treat things like essential tremor and Parkinson's disease-related tremor. However, investigators realized that you can also use the same technique of thermal ablation to ablate different areas of the thalamus which are involved in chronic pain circuits. And there's been a lot of clinical evidence thus far that suggests that thermal ablation of various regions of the thalamus leads to durable, lasting pain control with mild adverse events. In addition to that, there are still 5 ongoing clinical trials which are investigating ablation of various targets within the thalamus to treat chronic pain conditions.
Another way focused ultrasound is being used is in the thermal ablation of the medial branch. What is the medial branch and why is it being targeted to treat chronic pain?
The medial branch nerve is a nerve that supplies sensory information, so pain signals and other types of sensory information from your back joints to your brain. And so it really is the nerve that signals back pain to your brain. And specifically, it is the nerve that signals back pain from your back joints that are called the facet joints. And the facet joints are the joints that get arthritic, or as we age, you get arthritis in your facet joints. And this is one of the leading causes of low back pain is arthritis in your facet joints, which is also called facetogenic arthritis. And with focused ultrasound, there's a company called Fuss Mobile that has developed a device that uses thermal ablation. So again, intense heating of the tissue, which then causes necrosis of the nerve itself. And this device has been shown in clinical trials, both in the United States and in Europe and Canada, to be as good as the current standard of care for the treatment of facetogenic back pain. And the device has actually just received approval in Canada, the UK, and Europe. And they are working on securing FDA approval for this device in the United States currently.
Could we see that in 2025?
It is definitely a potential.
Could this kind of treatment be used as a way to replace pharmaceuticals for pain treatment?
Yes, it absolutely could. And it has been shown actually in the clinical trials that have completed and reported out their results that some or most actually of the patients that have been treated with thermal ablation of the thalamus have actually been able to completely discontinue most of their pain medications, including opiates. So we're really hopeful that this technology and this particular treatment will be able to help combat the opioid crisis.
Are there any clinical indications that you are looking at for 2025 that we could see a lot of development with?
The indications that I am most excited about seeing development with are in the brain tumor space, so glioblastoma and DIPG-DMG, which is a pediatric brain tumor. And the reason behind that is there's a lot of work going on with different mechanisms to both enhance the effectiveness of chemotherapy and immunotherapeutic drugs for brain tumors, and also to enhance the detection of biomarkers within the tumor that you can get through the blood or CSF that have been able to be enhanced with focused ultrasound blood-brain barrier opening, as well as another technique or mechanism called sonodynamic therapy, where focused ultrasound is used to activate a non-toxic substance called a sonosensitizer into a toxic substance, which then leads to tumor cell death. So there are really three different areas where within the brain tumor space where focused ultrasound is making an impact. And that's one is with drug delivery and enhancement of drugs themselves, like chemotherapy and immunotherapy. The second one is sonodynamic therapy, and the third one is through enhancing liquid biopsy or the detection of biomarkers in the blood and CSF.
Not only is focused ultrasound being used for diseases and conditions in humans, but the technology also provides non-invasive treatment for animals. We spoke with Dr. Kelsey Timby, part of our veterinary medicine program and scientific programs manager, about the latest. How are veterinary programs utilizing focused ultrasound?
Right now, we're primarily working with veterinary schools to run clinical trials using focused ultrasound.
And what are some of these clinical trials? What conditions would they be covering?
Most of our vet clinical trials are treating various forms of cancer, like soft tissue sarcomas, osteosarcomas, but we are funding trials that are treating other conditions like diabetes and urinary tract stones. One point that I am a big stickler about is all of the patients that are treated in our clinical trials that are funded through the vet program are truly patients. So these are all like people's pets that have naturally occurring disease of some kind that are coming to us. But we saw really promising preliminary data from the diabetes trial in cats. And this project is just such a great example of how human and animal medicine can be integrated, because the end goal is to have a device that can treat type 2 diabetes in both species. So what this trial is doing is that it's helping gather data for FDA approval while also supporting the development of a smaller and ideally wearable ultrasound system, because that's where they want to go for the human patients. And then we also had a urinary tract stone trial that completed in 2024. And the results were so positive that the veterinarians actually kept the focused ultrasound system, and they're using it now in clinical practice. That jump from clinical trials to clinical practice is really a huge step forward. And that's ultimately what we're going for all of the diseases that we're treating.
That's incredible. And so this would be a non-invasive form of treatment for cats that have this issue, right?
Correct. Yeah. The current option for these animals is a pretty invasive surgery, and the success rate of the surgery is fairly low. So this is a really big jump, and the vets are very excited about it.
So we've heard about clinical trials involving cats and dogs, and there's even clinical trials involving horses. Can you tell us about some of these projects that started in 2024?
Yes, so that's a two-stage project. The first stage is developing the equipment to treat horses, since we haven't done that before. And then the second stage will actually be bringing the patients in. So they are just finishing up the technical part of the project, and they'll have the first equine patient treated probably in Q1 of 2025.
And what condition is that treating?
They are treating sarcoids, which is a type of cancer that's fairly common in horses. It's very superficial, and it can be, really difficult to treat, just because horses are, they're living outside and in pastures, and trying to do surgery on a very superficial lesion where you can't really close it back up afterwards, it is pretty difficult.
And what can we expect to see in this field in 2025?
We've got a couple new vet research sites that will be going active in 2025, which is always exciting to see. In addition to that equine study, which I'm really excited about, we should be getting some results from quite a few trials that are using focus ultrasound to treat osteosarcoma. This is a really aggressive form of cancer, and it affects both dogs and children. So it's, really translational in that sense. But because it is so aggressive, the vets originally started with safety and technical feasibility trials, and those have been completed. So they've now moved on to collecting longer-term efficacy data, and those results should start rolling in 2025, and that should be really interesting.
Another emerging topic in the focus ultrasound field is cell and gene therapy. Here's Dr. Frederick Padilla, Director of the Gene Therapy Program and Director of Applied Physics Research. How is focus ultrasound being used in gene and cell therapy?
Yeah, that's a great question, and it's a very exciting field to be in. So in the gene and cell therapy field, especially to treat brain disease, there is a big hurdle, which is how to deliver these therapies to the brain because of the blood-brain barrier that will prevent anything to go into the brain. There is a delivery issue.
How is focus ultrasound being used in gene and cell therapy?
We've been focusing our efforts mainly in brain diseases to use first to open the BBB transiently and to help deliver gene and cell therapies.
And what were some significant milestones in 2024?
One of the first milestones is the development of new cargoes of carriers, if you want, to deliver these gene therapies, which are called capsids. And there have been development of capsids that have been optimized to work better with when combined with focus ultrasound. And there have been reports also of delivery of other types of vectors, and especially nanoparticles, to deliver gene editing medicine like CRISPR-based gene editing. And finally, another field that is also blooming is all the field that is called sonogenetics, or how to remotely activate and control gene therapy or gene editing, for example. And there have been reports showing that you can control CRISPR gene editing type therapies with ultrasound remotely.
Do you expect to see more work specifically with that in 2025?
So we are expecting to see more data published on non-human primates again, and this is really important to make the transition from the lab to the clinic. I mean, these data are fundamental to obtain, and we are funding such of this project that we are aiming to be completed in 2025. We are also waiting for the publication of a veterinary clinical trial that we funded in Stanford to deliver, again, nanoparticle-based gene therapy in dogs to treat liver tumor. And we are also really excited to hear about new mode of administration, meaning by that focus ultrasound and gene therapy or cell therapy so far have been combined with these therapies injected systematically, IV, intravenously. But it seems that there is a kind of a paradigm shift toward new mode of administration, so to combine first with direct injection of this therapy into the brain tissue or into the brain cerebrospinal fluids to provide, again, better efficiency and better detargeting of the liver, of the heart, which are organs that you don't want to be affected by the therapy aiming for the brain.
And how could this research in gene and cell therapy impact patients and future patient outcomes?
Yes, so currently the gene therapy approved to treat brain disease are using direct injection. So it's a very, very complex and lengthy procedure, especially if you want to reach deep structure into the brain. And so the hope is that the combination with focus ultrasound will allow this procedure to be more, let's say, streamlined or accessible. And that will open the door to the treatment of many diseases.
So in 2024, the foundation hosted a gene and cell therapy workshop. What were some of the results and what were some of the conversations that came out of that workshop?
So a lot of excitement, but also the need to see FUS as a platform for delivery to be more democratized, to really spark full interest. So that was one of the conversation. A conversation around the mode of administration, if it's better to deliver these therapies IV, which means you need to deliver a lot in order to have just a few going to the brain, which leads to toxicity, which leads to manufacturing issues with very high cost. And so trying to prevent all these issues with other mode of administration. Another highlight that I wanted to mention is that we started a partnership with the American Society for Gene and Cell Therapy. And so the ASGCT, American Society for Gene and Cell Therapy, is one of the largest society around gene and cell therapy in the US and in the world. And we have partnered with them to create an award specifically focused on the combination of focused ultrasound and gene or cell therapy. And the first call was released earlier this year, and we will be publishing the result of the call and the first project that was selected very soon. But this is a very exciting way to bring into the first world, let's say, people that are coming from different horizons, that will bring different expertise into our field.
Thank you to all of our experts at the Focus Ultrasound Foundation for their recap of important milestones and updates from the field in 2024 and a look ahead at 2025. Our mission at the Foundation is to provide non-invasive, life-changing treatment options for millions of people experiencing serious medical conditions by accelerating the development and adoption of Focus Ultrasound. We thank you for your support and wish you a happy and healthy new year. This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you'd like to learn more about Focus Ultrasound or the Foundation, visit our website at fusfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focus Ultrasound. You can also rate and review the show.